Thank you for joining us this evening for the Community Development Forum Part 1, a review of the city's CDBG and ESG 2021 performance. Unfortunately, our Bureau Chief, Craig Walt, is unable to join us tonight, but he left a welcome recording that I will play right now. Please note that this meeting is being streamed on the city's social media accounts and recorded and posted to the city's YouTube account.
Good evening, everyone, and welcome. My name is Craig Walt, the Bureau Chief of Lead Safety and Community Development, and I'd like to thank you all for joining us this evening for our Community Development Forum focused on the 2021 review of our CDBG and ESG funding programs. Really apologize I could not be there this evening. Had some unexpected illness crop up, and so I'm unfortunately under the weather. Please note that this presentation will be recorded and available online, and we may also have some folks joining us virtually this evening. So to kick us off, the purpose of tonight's meeting is to review highlights from the city's 2021 annual report to the Department of Housing and Urban Development, referred to as HUD, related to the city's Emergency Solutions Grant and Community Development Block Grant funds. Overall, we aim to provide an overview of the various programs and services supported with these federal dollars. This meeting also serves as part one of a two-part series in which tonight we will be providing a snapshot of 2021, and in June we will reconvene to present the draft annual action plan for the 2022 program year, and we'll be seeking council approval of that plan during the June City Council meetings. We will talk more about those next steps at the end of tonight's meeting. So just to put this into perspective, and so tonight we are reporting out on year one of that 5-year plan. I'd also like to point out for a moment, organizationally, where much of this work takes place within Lancaster City government. Shown here is an organizational chart for the Department of Community Planning and Economic Development, commonly referred to as CPED. Our bureau, the Bureau of Lead Safety and Community Development, is one of 5 bureaus as well as the Office of Public Art under the leadership of Director Chris Delfs, and is positioned within the Division of Health, Housing, and Community Development, reporting to Deputy Director Rebecca Geiser. Our bureau consists of 2 main units or offices, the Office of Community Development and the Office of Lead Safety. Tonight's presentation regarding our HUD funds is driven largely by the work of the community development team and the wide variety of activities supported by their programs. But it's also my hope that you will also get to see how these 2 offices work together, specifically related to the city's housing rehabilitation programs. Similarly, you will see how this office supports programs and activities beyond our bureau, including other city departments and external community-based organizations. Our ability to best serve our residents with these funds would not be possible without collaboration with our partners, so thank you to all who are doing the good work on the front lines where the rubber meets the road. With that said, I'd like to take a brief moment to have the Bureau leadership team introduce themselves, because these are the individuals leading the administration and management of the city's community development programs. Again, my deep apologies that I could not be with you in person this evening, and hope that you really enjoy and have a lot of great takeaways from the presentation this evening. Thank you.
All right, thank you, Craig. Now we'll be moving on to some introductions.
Thank you, Bryn. My name is Simone Dia, and I'm a Community Development Administrator for the Emergency Solutions Grant. Primarily, my responsibilities are oversight and administration of emergency solutions grants, as well as providing support to our community partners in Lancaster City.
My name is Bryn McGowan, and I am also a Community Development Administrator within the Bureau of Lead Safety and Community Development. I'm primarily responsible for managing the city's community development block grant portfolio and liaisoning with internal and external partners to ensure that that is administered well.
I'll try to make this brief. I've been known to talk a lot. My name's Darren Parmer. Thank you all for coming tonight. I just celebrated 20 years with the city, April 29th, and I have been working with HUD funds for over 20 years now, because it's past that date. And so I see some community partners that we have in the audience today, South End Concerned Neighbors, that we've helped over the years with housing and rehab programs and such. And through my time here with the critical repair program, the lead hazard control program, and the homeowner rehab program, we've helped a little over 1,200 families over my career, and I'm so happy that it continues to grow, and that our program continues to grow, and our staff continues to grow, and that we're looking forward to helping many more families in our community. So thank you so much for coming.
Hi, everyone. My name's Elise Poi, and I am the program administrator for the department. I provide administrative oversight and support for the critical and lead hazard control program.
All right, thanks everyone. Now moving on to a community development program overview.
Good evening, everyone, and thank you again for coming out to our 2021 Public Performance Program and Performance Public Meeting. In this section of the presentation, I will provide a brief overview of HUD's purpose in a dissemination of federal grants and define some of the federal entitlement programs that are provided to the City of Lancaster. So for those of you who are unfamiliar with the term HUD, let me start by saying the acronym HUD stands for the U.S. Department of Housing and Urban Development. HUD is a government agency responsible for national policy and assistance programs related to housing needs. These programs are designed to improve and develop the nation's communities and enforce fair housing laws. The purpose of HUD is to provide housing and community development assistance and to make sure all Americans have access to fair and equal housing. While HUD has oversight over many federal assistance programs, the one I will highlight later in this presentation is the Emergency Solutions Grant, otherwise known as ESG. So have you ever wondered which federal entitlement programs the City of Lancaster has the benefit of receiving? HUD provides the City of Lancaster with CDBG entitlement and ESG entitlement funds. All of these grants are allocated to states, counties, and local governments on a formula basis. The CDBG entitlement program provides annual grants to develop viable urban communities by providing decent housing and a suitable living environment, and by expanding economic opportunities primarily for low and moderate income persons. Essentially, to improve the quality of life for people with low and moderate incomes. Whereas the ESG entitlement program also provides annual grants, however, their respective focus is to support individuals and families who are homeless or at risk of homelessness quickly regain stability to accessing permanent housing. At this time, I'll turn it over to Bryn to share some pertinent details related to the CARES Act allocations.
So in addition to the annual entitlement allocations the city receives for ESG and CDBG, it also received a special allocation of both the ESG and CDBG grant mechanisms as part of the Coronavirus Aid, Relief, and Economic Security Act, or CARES Act. This funding was provided to the city to help us prevent, prepare for, and respond to the adverse health and socioeconomic impacts of COVID-19. We utilized both versions of these grants in 2021, and we'll be sharing a little bit about how they were utilized in greater detail throughout the presentation. We call these funds CV for short, and we will refer to it as such throughout the presentation. So just to provide some context about how the city develops and designs its community development portfolio and programming supported by CDBG and ESG. So we administer our grant funds on a 5-year consolidated planning cycle. with 2021 being the first year of our current cycle. We're on a 2021 to 2025 consolidated planning year right now. HUD requires that all of our programming supported by ESG and CDBG is designed and implemented through a 5-year goal-oriented framework. So as part of our strategic planning process for our current planning cycle, the city identified 5 primary goals that it will work to support with this funding through a rigorous community needs assessment. And those goals are to 1, maintain affordable, good quality housing for city residents. Goal 2, to increase affordable housing opportunities for city residents. Goal 3, to promote and improve neighborhood quality of life. Goal 4, to expand economic opportunities. And Goal 5, to support homelessness services. This goal, Goal 5, is primarily supported by the ESG grant mechanisms. So the city uses these goals to guide its development and implementation of its entire community development portfolio within eligible activity areas. So our presentation will provide an overview of how we utilize that from both an entitlement perspective and a CV perspective in 2021 to further the 5 of these goals. So now I'll turn it over to Simone, who's going to provide some additional information about ESG and how we utilize ESG in 2021.
Thank you, Bryn. So how do we distinguish between ESG entitlement and ESG CV? Since we know a bit about ESG entitlement, let me explain the difference with ESG CV. ESG CV is the Coronavirus Aid, Relief, and Economic Security Act of 2020, often referred to as the CARES Act. The CARES Act provided 2 allocations for homeless assistance to prevent, prepare for, and respond to COVID among individuals and families who are homeless or receiving homeless assistance. Additionally, to support other homeless assistance and homeless prevention activities to mitigate the impacts of the coronavirus. Next slide. In this slide, you will notice there are some very specific objectives for ESG program funding. The primary purpose of the ESG program is to engage homeless individuals and families living on the street, improve the number and quality of emergency shelters for homeless individuals and families, help operate shelter, provide essential services to shelter residents, and rapidly rehouse homeless individuals and families. While ESG funds encompasses a broad range of homeless service supports, its main objective is to quickly rehouse and help homeless persons rebound from a homeless tragedy. Next slide. This slide depicts the 5 eligible program components that fall under the umbrella of the ESG program that are used to assist homeless persons. They are 1, emergency shelter, 2, rapid rehousing, 3, street outreach, 4, data collection, or otherwise known as the Homeless Management Information System, or short for HMIS, and administration. Not necessarily in any particular order, but those are the 5 components. Note that up to 7.5% of a recipient's allocation can be used for administrative activities. Additionally, subrecipients may use ESG funds for 1 or more eligible activities. Next slide. The city of Lancaster is very intentional about fostering relationships and collaborations with community partners. In fact, it's one of our most adhered to core values, teamwork. Approximately 8 years ago, a joint funding application process was established between the city, the Office for the Coalition, Lancaster County Housing and Redevelopment Authority, and the United Way. This partnership was organized as a way to prevent the duplication of funding for similar services and to streamline processes. Ultimately, the group joined forces to combine service procurement processes and offer one funding application. The goal of the collaboration was intended to meet community needs and gaps, assign only funds needed for respective projects, and simplify the match and application process. Next slide. Because of the increasing need to find housing for our unsheltered population in 2021, we used our ESG entitlement allocation to support a rapid rehousing program and also cover some costs as it related to administration. As you can see, 98% of the funds for this allocation were utilized for short-term and medium-term tenant-based rental assistance and supportive services, and only 2% was used for administrative activities. Thank you. The following slide underscores the budget and expenses incurred in 2021 for our ESG CV allocation. You will notice there were more funds available and thus the opportunity for supporting additional programming and services for homeless individuals and families. Note, this pie chart embodies the total expenses spent for all categories, with roughly 76% being used for emergency shelter, 14% on outreach, 6% on rapid rehousing, and 4% on administrative activities. This next slide highlights the many community partners who are doing the work of undergirding and encouraging our unsheltered members. These providers are offering unwavering support in programming and services and are committed to providing a human approach to homelessness. A big thank you for all that they do. So you might be asking, what is street outreach? What is the emergency shelter? What is rapid rehousing? Just as the name suggests, street outreach is conducted by outreach workers who interact with the homeless population living on the street or in a place not meant for human habitation. Outreach workers offer resources, support, and provide critical essential services, such as engagement, case management, emergency health and mental health services, as well as services for special populations. Emergency shelter is any facility whose primary purpose it is to provide a temporary shelter for the homeless in general or for specific populations of the homeless. Rapid rehousing is designed to help individuals and families that don't need intensive and ongoing supports to quickly exit homelessness and return to permanent housing. With that said, I want to highlight the very impactful work that Community Action Partnership is doing in providing domestic violence services to individuals who are fleeing their abusers or attempting to make a plan to exit their current abusive situation, which you will hear more about later in this presentation. This slide illustrates data collected from the HMIS platform from our community providers, which is systematically monitored to ensure equitable access to programs and services. The pie chart on the left indicates we served 240 white persons of descent, 92 African Americans, 30 who were one of more races, 11 persons not captured, and 2 American Indian. All other races are not reported based on no collection of data. For ethnicity, we can see that essentially 72% of clients served are of non-Hispanic lineage and 28% are Hispanic or Latin American. The graph on the far right depicts the total number of households served with ESG funds. 287 adults, 96 children, and 3 unable to obtain. Based on the services received, the percentages on this slide are likely representative of the demographic population in the city of Lancaster. Next, listen to Bryn as she provides an overview of CDBG's programs and services for 2021.
Thank you, Simone. So I'm delighted to share with you guys a little bit more about the city's CDBG program and some of its performance accomplishments in 2021. So just to review, the city is currently working with 2 separate allocations of the CDBG grant. The first is the Entitlement Program grant, which is provided to the city on an annual basis. Historically, it has been valued at $1.5 to $1.7 million. And this is given to us to help develop viable urban communities by providing decent housing, creating suitable living environments, and expanding economic opportunities for city residents. In order to promote improved communal access, equity, and opportunity for the city's socioeconomically disadvantaged residents, CDBG is primarily oriented towards benefiting residents with very low, and moderate incomes. The city is also working with an allocation of CDBG CV, as previously stated, and this is a focus on helping to prevent, prepare for, and respond to the adverse community impacts of the pandemic and designing and implementing services within eligible activity areas, which I will discuss on the next slide. So this slide provides an overview of the 5 general activity areas that are eligible to be funded with CDBG activities. Primarily, we fund affordable housing preservation activities, public facilities and improvements, public services, economic development, and planning and administration costs associated with the administration of the CDBG program itself internally. So we design, implement, and fund activities both internally and with external community partners within each of these categories to support all of our community development goals, the broader goals of HUD, and to meet the needs of the city of Lancaster and its residents. So this slide just provides a high-level overview of the community organizations that we fund and work with CDBG funding. In regards to organizations that are currently implementing CDBG activities and projects. So you can see in 2021, we partnered with a diverse array of community social service providers to deliver critical programs in the community related to fair and affordable housing provision, social work, COVID-19 outreach and education, homelessness, hygiene, and health support, and economic development. So this slide just presents a very high-level financial overview of the amount of CDBG resources the city had to utilize in 2021. So for our 2021 entitlement grant, HUD granted us about $1.7 million. We also had around $2.4 million in unspent CDBG resources from prior year grants remaining that we continue to utilize on previously planned activities. Our CDBG CV allocation was around $1.5 million, bringing our total resources for CDBG in 2021 to about $4.1 million in entitlement funding and $1.5 million in CV funding. So what did we spend in CDBG in 2021? We spent around $2.75 million. $2.17 million of that came from entitlement spending, and around $585,000 of that was CV spending. So how did we spend that money, and what goals did we support with that money? We can see here, this slide presents a breakdown of how both CDBG entitlement and CV were utilized in 2021 to further each of the city's community development goals. We can see that a majority of the funding from both allocations, about 53%, was used to maintain affordable, good quality housing. A large chunk of the entitlement funding, around 33%, was also dedicated to furthering neighborhood quality of life, while a good bit of the CV funding, around 39%, went towards expanding economic opportunities, with the remaining CV funding being spent to promote neighborhood quality of life. From there, around 8% of our entitlement spending ended up being planning and administration support, with the remainder dedicated to increasing affordable housing opportunities and expanding economic opportunities. The handout that's included in your folder provides a breakdown of the spending by eligible CDBG category, and I'll also talk more about the programs within each of these goals that we spent the money on further on in the presentation. Next, I will talk about it next. So this slide provides a high-level overview of the overarching community development goals, as well as the different programs and activities that we implemented in 2021 to further those goals from both an entitlement and CV perspective. So under Goal 1, to maintain affordable, good quality housing, we had 3 primary programs supporting that goal. The first are the critical repair and lead hazard control programs, which you'll be hearing about later on in the presentation. The second are the city's internal proactive housing code enforcement program, which works to improve the health and safety conditions of city homes, prevent the deterioration of the city's housing stock, and is focused on city areas occupied by low-income persons. Lastly, we funded the Eviction Prevention Network with CV funding in partnership with both Tenfold and CAP, which provided emergency rental and utility payments for city residents experiencing housing insecurity as a result of the economic hardship caused by the pandemic. Within Goal 2, increase affordable housing opportunities, in 2021, the city funded a housing affordability study undertaken by the County's Center for Regional Analysis, and it also funded internal comprehensive planning work, which collectively are working to help us develop viable, inclusive, and equitable solutions to the city's affordable housing challenges. You can see from this chart as well that Goal 3, promote neighborhood quality of life, is supported by the most variety and the highest volume of projects within our CDBG portfolio, and is primarily furthered through the provision of public service activities. In 2021, they included the place-based streetscape improvements program. That's a tongue twister. This provides streetscape improvements and enhancements and rehabilitation to make the streets safer and improve the quality of life for the residents of the area. And in 2021, we completed revitalizations of Howard Avenues and Highland Avenues with this funding and with this project. We also funded the Fair Housing Services Program with Tenfold, which promotes the provision of fair and equal housing opportunities in the city through outreach, education, consultation, and advocacy. Internally, we fund a health and housing social worker who is focused on promoting and improving resident health and housing well-being and improving access to affordable housing opportunities for the city's most vulnerable residents. We fund a neighborhood crime reduction through police social worker program with the Bureau of Police, which you will hear about later in the presentation as well. We also fund a downtown outreach specialist in collaboration with Lancaster City Alliance with CV funding, who conducts outreach to community members in need of assistance to holistically address some of the complex socioeconomic challenges exacerbated by the impact of COVID-19 and provides street-level connection to services for vulnerable city residents. We also funded a city health worker for COVID-19 support with CV money in concert with LGH. And this activity provides education and outreach for pandemic-related health concerns. It administered COVID-19 vaccinations, and it conducted a community needs assessment to improve the health outcomes of Lancaster City. And then finally, the city began to fund a project called Refresh Lancaster with Lancaster EMS, which is currently providing mobile health and hygiene services for the city's most vulnerable residents, especially those experiencing homelessness, and helping them connect to critical medical support to improve their health outcomes. Within the Expand Economic Opportunities goal, we have 2 primary activities right now. The first being the microenterprise or small business development program in concert with Assets, which provides technical mentoring and support to low and moderate income city residents who wish to establish and expand microenterprise businesses. We also funded some building codes work within vulnerable areas of the city to prevent property decline and promote economic revitalization for businesses and cities in the area that were unduly impacted by the pandemic. And then finally, we also funded some planning and administration work as well. So on to outcomes. Let's focus on some high-level outcomes that were collectively achieved by CDBG in 2021. So we can see from this slide that CDBG, both entitlement and CV, provided 3,251 city residents with a direct benefit. This includes our housing rehabilitation programs, our code enforcement, the eviction prevention network, health and housing social worker, fair housing services, neighborhood crime reduction through police social workers program, our downtown outreach specialist, our public health worker for COVID-19 support, and Refresh Lancaster as direct benefit activities. 538 of those individuals were provided with a direct affordable housing benefit through the city's rehabilitation programs, the eviction prevention network, our health and housing social worker, and the fair housing services program. And then finally, 95% of the direct beneficiaries served by CDBG in 2021 were of low and moderate income, kind of demonstrating the city's commitment to improving and promoting inclusive service promotion in alignment with CDBG's philosophical principles. Okay, and next up, we would like to highlight 1 ESG and 2 CDBG activities, and we will hear from program staff about their respective programs and their 2021 accomplishments.
Thank you, Bryn. At this time, I would like to welcome Christine Gilfillan, Director of Domestic Violence Services at Community Action Partnership. Christine previously worked in Berks County at Safe Berks for 17 years. She joined CAP in 2018 and has been the director for the last 4 years.
Thank you. Thank you for having me. I thought that I would spend a few minutes with you this evening telling you a quick story that sort of illustrates the continuum of care that's provided by DVS, that's funded by partially funded by ESG. Maria is not this person's real name, but Maria married her husband about 13 years ago. They have 3 small children. Her husband has always been emotionally abusive, putting her down, just attacks on her self-esteem. And he maintains control over their finances, which is a circumstance faced by a lot of domestic violence survivors. When his abuse escalated to physical abuse, the police became involved, and that's when the family secret was no longer the family secret. When the police responded, they used a protocol called the lethality assessment protocol, and they did an assessment with Maria and determined that it would be a good idea to connect her with a hotline worker from DVS. So that connection was made. Maria spoke to the hotline operator. That's available 24/7. She did some safety planning. And after they had a conversation, they determined that it wasn't safe for her to stay where she was any longer. So they brought her into our safe house, or our emergency shelter. She had to escape quickly. She arrived with very little, just her children and a couple of bags with some clothing and personal items. She was scared, but she was ready to make this step. The police also encouraged her to file a protection from abuse order, and she was able to get help from her DVS advocate to do that. She also was able to connect to our legal center, where we serve over 1,300 individuals each year, mostly in assisting them to get protection orders for their safety. She stayed on at the shelter for a period of time. Typically that stay is 30 to 90 days, depending on circumstances. A little longer during COVID, unfortunately, for shelter stays. The advocate helped her to understand her situation, and then the next thing up is to help her and her family connect to housing, which is one of the biggest challenges that they'll face in terms of affordability and the resources that they have. Because her resources weren't ready yet for permanent housing, we did take the family into our transitional housing program. Again, that's a temporary emergency housing program. Lasts a little bit longer than emergency shelter, But eventually that extra time was what they needed in order to get back on their feet and be able to move into permanent housing, which we're able to assist them with as well. So most people think of DVS as a emergency shelter hotline. We now have a text line, which we brought up and running during COVID so that folks could reach out to us without having to speak on the telephone, which could be a safety issue if you're trapped in the same home or apartment with an abusive partner. And it goes all the way to assisting people as quickly as they can. They have a lot of barriers and a lot of things to overcome, but to assist them as quickly as we possibly can to move on to permanent housing. During COVID, we've been, our communal style shelter was not conducive to safety during COVID-19, so we benefited from CV funds from a number of sources, including the city, where we were able to do some sheltering in local hotels. Over 2 years later, we're still doing that for a variety of reasons. And that's been a real challenge, but it's worked out well in terms of allowing people, residents of our shelter, enough space to be able to spread out a little bit and not be so confined within that communal setting. And sometimes the hotel locations also work better for survivors for different reasons. Sometimes they have pets or other challenges where we've found, we've learned a lot of lessons from COVID, but one that we've learned is that different settings have different benefits in terms of serving survivors. So it's been wonderful to have, in a tough time, to have the resources that we needed to be able to meet people's needs the best that we can. We also offer counseling and support groups. Those are community services, not just for individuals living in our residential programs, but for the community. We've been able to, one of our accomplishments over the last year is that we've been able to build a stronger economic advocacy program, knowing that for survivors who've been economically marginalized and abused, they also need to rebuild their economic stability or achieve an economic stability for the first time. So we have increased those efforts. And through some HUD DV bonus funding later this year, we'll be launching a much more comprehensive housing advocacy program as well, including rapid rehousing and other resources for survivors in terms of finding housing. So that, together with education and prevention programs, we offer professional trainings to the community, and we also have a pretty robust internship and volunteer program, which is a way for folks to get involved. Those are some of the things that we're working on right now. But, our gratitude for this funding and for this support, and, we'll keep moving forward. So, you're welcome.
Okay. Next, I'd like to highlight a CDBG activity called the Neighborhood Crime Reduction through Police Social Worker activity, and invite Ms. Leilani Tran to come up and tell us a little bit more about her work. Leilani has her master's in social work from Temple University and has been with the Bureau of Police for 3 years.
Thank you so much, Bryn. So happy to present to you all the work that we have been doing since 2019. Like Bryn said, I will be highlighting year 2021. So just a little bit of overview on what this program is and what we have created it to be. So social workers working within police departments are available not just to the police bureau personnel, but also to all community members, as well as social service agencies that we partner with. And our work mainly revolves around assistance, information, and referral source. So that can be on a police call on scene, or if any other social service agency is in need of support for coordination of care if they have not been able to engage with their individual consumer. So really what we like to say is that we act as a liaison between police and community services. In year 2020 to 2021, I think I went to. So we started off year 2021 in January by hiring our second social worker, my partner Grace Menser. She started in January. One of the things that we had noticed and worked on is that having one is not enough because social service is something that we see a need in not just in daytime hours but also in the evening and nighttime. So this has become a great support and help for the city residents as well as staff during the night and evening hours. In year 2021, we were able to support 541 service area beneficiaries, and I will move on to the next slide and show you a little bit of breakdown on what that looked like. So as you can see here, these are all of the categories of individuals who we served. We have mental health being our biggest component of residents served, going at 51%. We had neighbor dispute interpretation services. One of the cool things I like to say is that, we're able to, I was born and raised in the city, and so my partner Grace Menser as well, and we both speak Spanish, so we're able to not only help officers sometimes with interpretation, but making that person comfortable at that time with any police encounter, being able to speak the same language is really helpful. We were also involved with welfare checks, aging concerns. We have here assault, and by that I can just say, if just being on scene to support the victim or any ongoing services that they may need. Assist residents, that's a kind of a broad category because we have a lot of individuals who come into station as well as call the police for different services, and so we just help them navigate that and refer them to where they need to go. Child welfare checks, death support, whether it's a death notification or assisting a family during that difficult time. Domestic disturbances, drug and alcohol calls, and individuals experiencing homelessness or housing issues. So just helping those individuals get connected to the agencies that they need to contact in order for them to receive the support that they need. The other category that we have here that is, I believe, 4% of those calls can vary in many different things. So we have individuals seeking financial assistance, sometimes not knowing where to go, so we just guide them in the right direction. Individuals experiencing some medical concerns, just helping them advocate for any home health aid services or just getting them in contact or starting that process with case management, medical case management for them. Animal complaints, if we're trying to help individuals with that, and civil matter issues as well. We'll support individuals in that way. So one of the biggest goals that we established early on when establishing our program with social work in the police department is really looking at the reduction in repeat calls for police and a more positive interaction between police and residents. Hopefully to see the ultimate decrease in crime and increasing awareness and how to access essential support services within the community. And explain that a little bit further is a lot of the 911 calls that come in to our dispatch are calls that are not criminal in nature. A lot of individuals, they just don't know who else to call, so they'll dial 911. And so having myself and my partner Grace there, we're able to then navigate that with them, spend more time with them, just because the call volume is so high, an officer doesn't have the opportunity, and sometimes they're not aware of the social service, and so they're not able to support. So when we come in, we can sit down with them and we can guide them through that process in hopes that that person then gets connected and then the 911 calls stop. I would like to share a little success story with you, and I will not say the person's name. I will say that she is a female, but I will not share her name. We've been working with her for about a year, and in the year 2021, she called 911 81 times. And very, very sweet person. We started noticing early on in our calls and when we assessed her that there was some onset of dementia. And so we noticed during the time of the calls, it was probably sundown, and that person was experiencing some of those symptoms that comes with that diagnosis. So after much work with social service agencies, the family, and the officers who did really, really great on all of these calls, we were able to have this person go to the hospital, get an assessment, and place that person in a higher level of care where they're able to get the care that they need in order to just be well. It was a long time. One of the things that I also like to highlight with our work is that when we are with individuals in the community, it's about building relationships. And sometimes you can't do that in a 911 call right away. So one of the cool things I always like to say is that we build rapport with individuals. Sometimes, a lot of times, we are also helping the family understand what's going on, which is something that happened with this case too. It's not only hard on the individual calling 911, but also hard on the family who's experiencing this sudden change with their loved one. And what does that look like? So sometimes family members are obviously going through their emotional turmoil, so we're able to help them gather the information. Who do we need to call? Who do we need to involve? And just sit down with them and help them make those calls with the goal of having that person connected at the end of the day and knowing that their loved one is safe. And so sometimes we see those repeat calls because it takes time to build that relationship. It takes time to build those resources to then be able to connect that person. And it takes trust. That's one of the biggest things is trust. When we are there with individuals, they don't trust us right away, or they're wondering are we going to stick around? Are you guys going to help us? Or is this going to be something that I just call and then it's just going to get tossed to the side? So sometimes it's just building relationships. So here we just have a couple of photos of us in the community with our officers as well with other community partners, but we just really try to highlight on just being out in the community. You will see us sometimes in the downtown area, just connecting with individuals experiencing homelessness, just being involved. So thank you.
Thank you so much, Leilani. And now I'd like to introduce Daniel Sosa with the city's lead office, who's going to share a little bit more about our housing rehabilitation programs.
Thank you for having me. I just wanted to thank Craig, Bryn, Simone for putting this presentation together and providing the opportunity for us to talk to the community about the CDBG funding and the important programs that are provided through that. I also want to thank Christine and Leilani for sharing really great stories and showing how important CDBG funding can be. So I'm from the lead team, and the lead team administers two programs. The first being critical repair program, and the second being the lead hazard control program. The critical repair program is funded by CDBG, and the lead hazard control program is supported with the CDBG funding match on a number of the projects that we do through that program. The CDBG funding is vital to the day-to-day operations of our team, very important. So the two different programs that we have do two different things. The critical repair program, if I were to explain it in an umbrella term, would be any issue that can affect the safety or health of a person at their house, is something that the critical repair program would want to address. For example, roof repair or plumbing issues or an electrical problem, heating and cooling issue can be very, very important during the winter and summer respectively. And also mobility and safety issues that might be in a house, like a tripping hazard on the floor or lack of handrails going up to the house or up to the second or third floor. Any one of those could be something that is addressed by the critical repair program. The lead hazard control program does what the name says it does. We are trying to identify and eliminate lead hazards from homes. That involves lead inspections, paint stabilizations, window replacements, door replacements, and ultimately lead safe certifications for homes. Both programs are very vital to providing accessible, safe housing here in Lancaster City. So this is kind of a breakdown of the money that was spent on these various programs. As you can see, a little bit over $280,000 were spent on critical repair program projects, 30 distinct projects, and then about $250,000 was helped to fund the lead hazard control program projects, about 49 of those. So hundreds of people were helped by these projects over the last year, 2021. And then another chunk of money was spent on staffing, supplies, and other costs within our team, at the lead team. And so the numbers can say one story, but I personally like to think of the programs that we administer on a person-to-person basis, because there are real families that are affected by the projects that we do. One in particular that really stood out to me was a resident on South Plum Street, Georgia Johnson. I was able to speak with Georgia about her project recently that we did at her house, and I've had the opportunity to speak with her in her home as well on a couple of occasions. And something that really stuck out to me was a photograph that she had on the wall. It was a snapshot in time of her kids and the neighborhood kids sitting on the front stoop of her house in the 1980s, which was creeping up on 40 years ago, believe it or not. And it just really showed that this family has been part of Lancaster for a long time, and they still are, and they will be in the future. And the project that we were able to do on that house included several window replacements, new paint on the walls and on the ceiling, new ceiling tiles, gutter and downspout installation, repairs to the balcony and to the porch. It was a big project that really benefited Georgia Johnson and her family, and it was giving back to something that she's already given to the city by being a resident here for over 50 years. It really stuck out to me, and this is just one of many stories that come across our team every year. And it's a massive benefit to us to know that we are doing some good stuff. Going forward with this program, with these programs that we administer, we're looking forward to expanding grant opportunities for city residents, in particular individuals 62 and older. I'm not going to say elderly. My mom would not appreciate that, but just individuals 62 and older, folks with disabilities, low-income families, and also families with high housing cost burdens. We look forward to doing more projects in the future, and one house at a time, making it safer, not just for this generation, but for the generations to come and the future. Thank you.
So I just wanted to thank each and every one of you for coming out this evening on such a lovely day and to spend time with us to learn a bit about what programs it is that we administer and how those programs are impacting the community. We'd like you to stay tuned for part 2, which will be taking place in June, date to be determined, in which we will discuss our draft annual action plan and our 2022-2023 CDBG and ESG allocations.
Okay, great. Now we invite you to approach any member of city staff with any questions or comments you may have about our community development programming. And thank you guys again for joining us this evening. Have a good one.